好，各位委員
Members,
各位委員聽到我講嗎？
members, can you hear me?
我而家宣布咧，我哋已經有
I now declare that we have got a quorum.
會議正式開始。
We will begin our meeting.
而家就係進行咧係預防及控制疾病。
So this is a subcommittee on subsidiary legislation relating to the prevention and control of disease. So we conduct this meeting on Zoom. Members, please note that when you speak, you must turn on the video function of Zoom and show your face. And upon my direction, your microphones will be turned on. When members take part in video conferencing, you must use the three different color backgrounds of LegCo. So now we will move on. On the 25th of February, in the HC meeting, members agreed to set up this subcommittee. And on the 8th and 23rd of February, 6 subsidiary legislations were gazetted. So number 12 to 15, 23 and 24, LN. The subcommittee this time is considering 6 subsidiary legislation. They can be divided into the following 4 areas. 1, those related to social distancing measures, 12, 13, and 24, LN. So that is prevention and control of disease, requirement and premise regulations 599F, and also 599G, and also about regulation on the wearing of masks 599I. And then the LN15 related to compulsory testing, and that is the regulation 599J. And then those related to vaccine pass, LN24. And that is the 599L, CAP 599L. And also LN24, and that is emergency situation exemption regulation. 241, CAP 241N. So please refer to papers from the administration. CB bracket 4136/2022 bracket 05. If you have no other comments, then in today's meeting, we will discuss all the LNs, all 6 LNs together, especially about the policy matters. So now I will invite the administration representative to go through the subsidiary legislation. After that, I will invite questions from members. In order to be fair and orderly, I will now invite our helpers to first clear the raise hand icons under members' names first. So now if you would like to speak, then please press the raise hand function key. Okay. Now, I will wait for the clerk to do a check, and then I will read out your names at this stage. So right now, we will invite the administration to go through the subsidiary legislation. Let me say again, members, we will discuss all 6 subsidiary legislation, legislative and policy directions together at one go, okay? Now, let me invite the administration. Thank you, Chairman and members. Right now, the pandemic in Hong Kong is in a dire situation. It is worsening fast, and we can anticipate that the number of confirmed cases will continue its exponential growth. In face of this wave of the pandemic, We are doing a lot to respond, and we are adjusting measures accordingly. However, the speed of the spread of the pandemic is much faster than what we are able to cope with. So the administration has already announced a number of measures, including tightening social distancing until 24th of April, 20th of April. So concerning the catering and also scheduled premises and the implementation of vaccine pass, well, we also get the support from the central government to start a number of measures, including the building of hospital and also isolation facilities. For this, the government has amended 6 emergency regulations in order to provide the legislative basis. The first one is 599F. So on the basis of 17 scheduled premises, 6 more are added, including barber shop, hair salons, religious premises, shopping malls, department store, markets, and also supermarket. Number 2, 599G on prohibition of public gathering is amended. So the upper limit of people allowed is changed from 4 to 2. And then in private premises, there are regulations to prohibit multi-household gathering. Number 3, the amendment on 599J. So when there is non-compliance of the compulsory testing direction and also direction in relation to restriction testing declaration operations, the fine will be enhanced from $5,000 to $10,000. And then number 4, 599I amendment about wearing of mask. So in outdoor spaces, if people are engaged in physical exercise and also on public modes of transport in a restricted zone of MTR, eating is no longer a defense. And then amendment to 599L, and that is the secretary is empowered to issue instruction about vaccine pass, saying that the pass can apply to all kinds of premises. And exemptions are also laid down, for example, children below 12 years old, and also for those who cannot take vaccination for medical reasons, and also purely buying food or waiting for takeaway, and those subject to medical treatment. The CS4A, when the conditions are in place, then can waive the necessary regulations in relation to registration so that Hong Kong and the central governments can get the necessary support. For the 5th wave of the pandemic, well, this is a dire challenge for Hong Kong. The government and different sectors have to fight the pandemic hard. We hope that members of the public will work with us together to ensure public health. We hope that we can restore normal life as soon as possible. Thank you. Can you hear me? Sorry, let me read again. 邵家輝、邱達仁、龔慧敏、楊永傑、林少魯、鄭飛、曹浩定、邝玉歡、Elizabeth Kwok, Chen Hoi-yan, Michael Tin, and I myself. So 12 members altogether. I will allow each 4 minutes, including both the question and the answer. So now the first one is Siu Ka-fai. Please start the timer. Thank you. Secretary, under this wave of the pandemic, you can see that the market is so quiet. many people said that even if the establishments are allowed to open, there is no patron really. Now, you want to reduce footfall. I do agree. Some members of the business sector said that the pain should be shorter rather than long. So you just can prohibit people from going out so that society can restore normal as soon as possible. Recently, messages are chaotic. Dr. Chen said that there would be total ban on movement, but then the CE said no. So it seems that the message is confusing, and this will represent a big shock to society. The retailers said that it is not true that they are out of stock. There is enough stock. However, well, at first they prepare 3 months of stock, but then members of the public are buying 1 year worth of stock. So no matter how much there is, it is not enough. So I hope that in the future, when you disseminate information, please communicate with the trade as much as you can, especially when it will affect the adequacy of stock. And then now we are going to have compulsory testing. If many people are confirmed, then how are you going to deal with them? How will you handle them? If they are not serious cases, then they should be isolated at home. You will only send the serious cases to hospitals. So let's shorten the pain. Let's don't go out. When people travel to Hong Kong, well, they are quarantined in a hotel for 14 days. They cannot go anywhere. And before the 5th wave, for 6 to 8 months, we were successful. The virus could not come to Hong Kong. So if you don't go out for 14 days, there won't be virus. For Hong Kong people, if they don't go out, if you provide them with enough food and medicine, then even if they are ill, they will recover. So how come you don't curtail the pain, just prohibit people's movements? So I think if this continues, I think the trade will die. Yes, you can see how the business sector views this matter. It is better to have short-term pain than the long one. Now, we are paying attention to the market actually in the past few days, no matter whether we are talking about the CE or CS for A, through different platforms, we are giving members of the public a message. I think Mr. Shiu is talking about the coming territory-wide compulsory testing. And the CE had said very clearly the importance of this exercise, and this is a big one. And when we do a plan, we have to be very careful. We have to consider different people's needs in Hong Kong, including the finance system and also people's daily livelihood. So the details have to be ironed out first, and then we need to let members of the public know so that they can be well prepared. Concerning the mild cases and serious cases, during this time or when the testing is completed, well, the government had said that if there are many cases within a short period of time, the community isolation facilities may not be able to cope with all the cases. We have to prioritize the cases. For serious cases, they should be hospitalized. For milder cases, they can be in community isolation facilities. Some will have to stay home. So that's my simple answer. Okay, second member, Mr. Yao Tan. Thank you. I have a question about vaccine pass. Now, the new direction is that now we know that vaccine pass is being implemented. So when you scan the Leave Home Safe app, you have to have it checked again. And the front camera of some mobile phones is not good enough. And especially when there is the anti-glare lens, then it is very bad. Sometimes the devices follow people, follow the managers. So in many premises, they really are not able to scan all vaccine passes. So in terms of implementation, how can you make sure that all customers are checked? Now, last week, you said that the high-risk infected areas will not be announced. So people are wondering why they still need to scan the Leave Home Safe app. So what is now the plan regarding vaccine pass? Some reports these 2 days stated that there are guidelines on vaccination of recovered patients. If there is a recovered patient who has not been vaccinated, right now he is getting the first jab. So commonality 90 days, and then coronavac 180 days. Then people can't go anywhere if they opt for coronavac.
Thank you, Madam Chair. Concerning the technical implementation of the pass, we believe that from certain technical angle, it may not be seen as convenient, or some people see room for improvement. We will pass this on to the Bureau to see if they have any new ideas. Concerning the use of Leave Home Safe with the development of the pandemic, the administration has explained already there are simply too many cases, and when the pandemic continues to spread, it is possible that wherever you go, you may meet with cases with no symptoms. So perhaps it is not the most necessary or effective way forward. We may not have that app everywhere, and every member of the public needs to stay very alert. So people who should go through inspection, whether it is the self-rapid test kit or go to other places or venues for this, we can try to do it so that we can have early identification. For those who have already recovered, what about the vaccination arrangement? As we have said, the timing separation should be a few months. So if someone can provide proof that he has already recovered, it is acceptable. And there are also medical exemption certificates written by doctors to prove that someone has already recovered. And health department can also issue similar certificates in the future to allow people into premises. If there is no follow-up, Kan Wei-man. Well, because we are looking at 6 regulations and 2 of them are brand new, so please give us more time to ask questions before close to close. I'm happy that the Secretary has already responded by saying that the design of the vaccination pass is no longer sufficient to deal with the exponential growth of Omicron infections. If we again have 50,000, 60,000, well, the total figure is approaching 400,000. So the priority is isolation and treatment, save lives. But we can't place cart before the horse and say because some people argue it is meaningless to identify cases. There's no need for comprehensive detection. We still want to focus on early detection. Under the vaccination pass, we may not be able to trace all the infected persons. So I hope that while we are doing the scrutiny work here, we still need to continue on with the tracking and tracing. It is not about IT issues, and it is not a privacy matter. To do the job well, to look forward. Of course, we don't want this to happen, but if we have the 6th wave, we need to continue on with the tracing function. Concerning the pass, there are exempted persons, and they have to provide information in relation to the name, address, and contact details. The Secretariat has already mentioned earlier. If the information does not involve anything encrypted, there's no need for the issuance of a guideline by the Privacy Commissioner, but there are exempted persons who have to leave behind their personal information at the premises. So can I ask the administration, how are you going to protect such personal information if we still need to use the pass? The chairperson of the Housing Authority recently said during an interview that without the tracing function attached to the app, it is not that effective to resolve the pandemic. So let's not stop here. We need to truly implement the tracing function. As for the requirement to leave people's real names, the telecom companies have already made it clear that we can have telephone SIM cards attached to people's true identity. We need to speed up the registration of these SIM cards that can be purchased everywhere. That is about 599L. As for the 241 emergency regulation, it is to be used on relying on mainland resources to carry out different tasks: isolation, inspection, medical equipment, and personnel, etc. So there is no other option. We need 241N. We need to use this regulation wisely because in terms of actual practice, it seems to be restricted to certain areas. It is possible that other members will also speak their minds. We need to use 241N well. We welcome this regulation, but today, in terms of usage, there is a lot of room for further expansion. I will stop here. Well, you have used up all your time. So I will allow a second round for sure, because we're talking about 6 pieces of subsidiary legislation. So we will allow the first round. After you have collected views from the members of the public, you have presented your views for the first round. I also hope that the administration has heard them loud and clear. I will allow a second round. Let me have a look. Who's next? Mr. Yang Wing-kit. Thank you, Madam Chair, Secretary. We are facing a dire situation under the pandemic. We all know that. In Pet Law State, about 18% of the population has been hit by the pandemic. So we are talking about almost 900,000 people who may be tested positive, and many people are treating themselves at home, but there are facilities and arrangements that are lagging behind, including the registration platform. It's still not yet available, and many people trapped at home need medicine, especially to fight fever. The government doesn't have it. People can't buy it in the market. So can the government help them and liaise with pharmaceutical companies and procure more fever-fighting medicine, or also a bigger supply from mainland China and then distribute them to 18 districts so that we can support the local residents? We need support from the community level to truly resolve the problem. If you can't arrange people to get treatment, they have to rely on such fever-fighting medicine. And there's a serious lack in relation to such medicine for children. Please try to understand what's really happening in the community and procure more fever-fighting medicine. Otherwise, people are facing possible death. I hope you understand the situation. Secondly, many people are doing rapid tests. Many people got tested positive. You are closing off certain housing estates or buildings, and people are trapped inside. They can't get through to the hotlines. So please, when people register, allow them to fill in more information about the living environment to see if you need to remove them and place them in the isolation facility.
好，多謝主席。咁咧
Secretary?
有關於呢個喺屋企隔離咧，我
Thank
哋都
you.
知
Concerning isolation at home,
有個現實嘅需要啦，因為
we do understand there is a realistic need because of the lack of facilities. We need to set priority to those who may need to be admitted in hospital
嗰個登記嘅平台咧，衞生
and
署
who needs to stay at home. We are still working on the registration procedure.
新嘅用嗰個自我檢測方法，即係抗原嗰個咧，係需要有登記平台。
And we understand that for the new platform, many administrative steps are involved. So please be patient. Medicine and other medical supplies have seen some shortage. So the government will continue to approach different suppliers to obtain resources, including relying on the support from our motherland. Secretary, I hope that you will provide more resources to the community so that we can send them to the residents. You can't act quickly enough and people can't buy them off the streets. There are 452 constituencies. Send them to the constituencies so that local councillors can distribute them to local residents.
議員嘅建議嘅，我哋要
Yes,
翻
I
去諗下。
understand. We will go back and see how we can help the residents further. The communities are very efficient and very experienced. We're just waiting for the government to react. You need to coordinate and we'll work alongside. And next is Mr. Lamsulo. Thank you. 559L concerning the vaccination pass. It includes public transportation, and I remember previously the CE said due to implementation or enforcement difficulties, public transportation won't be covered, but we do realize it's very risky. Omicron can be spreading through the air. On public transportation, even if you're wearing a mask, many people, many experts have already said that usual masks are not protective enough. So, when will the government be prepared to do something or implement the pass on public transportation, even after comprehensive inspection and testing? That is the first priority. You can't allow it to spread any further. 241N exemption. If we are looking at comprehensive testing, there are several services provided either by the government or other commercial operations closely tied to our daily life. I hope the government has a clear checklist in relation to exemptions. We're also launching voluntary work. Hopefully, this can be included as a kind of exempted item. If you're ready today, I would like to hear from you. Do you have that checklist now? Thank you. Under Secretary, concerning the new regulation that just came into effect, at this stage, we have launched the new arrangements for areas covered by 599F. We understand your view. We will look at the actual situation. Whenever necessary, we will launch new measures. Concerning compulsory testing, the future plan, we're still discussing many details internally. including the details of enforcement, the timetable. We are still discussing such details that you are waiting to hear. We don't have anything ready to be announced yet. If you want to obtain any particular further information, we will go back and notify the team responsible.
Chairman, a simple follow-up. This is not a question. The Hong Kong public on whether the Hong Kong government is well prepared to fight the pandemic, the Hong Kong public has very weak confidence. Based on the answer given by the Secretary just now, you are telling the Hong Kong public that the Hong Kong government is not prepared at all, even on simple issues like these. So when we talk about territory-wide testing or quarantine, how can we make the Hong Kong public confidence in what you are doing? I hope that the administration can make use of this platform of ours to make people confident. If you are still thinking, then this is really a big problem. Secretary, I hope that we can hear something more concrete. We have had meetings like this several times, so at this stage, there should be some very concrete information. I don't think members will be happy with your answers. So please go back and think. If these questions are asked again, at least you should give us more information. Next, Tang Fei, please. Yes, thank you, Chairman. Secretary, I do understand that the meaning of creating this subcommittee is so that subsidiary legislations can take effect, the SARG can be empowered to put in place more anti-epidemic measures. Since January till the fifth wave, members of the public are not worried about not having enough legal basis for the SARG to put in place some very extreme anti-epidemic measures. Now we are worried that with enough legislative basis, has the SARG be very decisive and very determined in putting in place these measures. Under 599, there are 6 scheduled premises, but as you know, no matter whether we go to supermarket or wherever places, well, we very often see that people do not scan their leave home safe. Yesterday, there was a clip in which we saw someone taking off his mask and he just salivated with not much consideration. So is there any law enforcement based on these circumstances? We are not worried that there is not the necessary law. The point is whether there is enough law enforcement. Can the government tell us, after the subsidiary legislations are passed, with such empowerment, is the government strong enough to enforce the law? At the beginning, it seems that you are serious with leave home safe, but now it is no longer useful. What about vaccine pass? If there are people breaking the law, are you going to take actions against them? I think this is a big doubt. Secretary, thank you, Chairman. In relation to all laws and also laws under Cap 599, basically there are 2 elements. First, law enforcement, and secondly, members of the public should also take the initiative to comply. So these 2 need to work together. If we look at 599 F and G, just now, members asked about the number of regulations enacted some time ago. And for different premises, there are different authorized people to enforce the law. So usually by means of patrolling and inspection. And if you refer to the figures, for example, 599I, about wearing mask, if we take that as an example, then no matter whether we are talking about patrolling or inspection, if we see someone and we give him or her reminders, there are also numbers on fixed penalty tickets. On 599I wearing mask, there are more than 10 million inspections and checks and 600,000 reminders being issued, and about 9,000 fixed penalty tickets are issued and 70-odd prosecutions. So actually, the law has been enforced. Okay, any further follow-up, Mr. Tang? No. Next, Mr. Holding Chow. Mr. Holding Chow. Chairman, can you hear me? Am I clear? Yes. Loud and clear. Thank you, Chairman. I would like to take this opportunity today. But today we are here to scrutinize some subsidiary legislations, including vaccine pass, and also the working arrangements of emergency people. So I have some questions about implementation and enforcement. First, on 241 emergency regulation. As we all know, the central government gives strong support to us by sending people to Hong Kong to help. Now that the pandemic is in such a bad situation in the community, we can see that the frontline people have hard time. Some of them have been confirmed, and we are seeing a shortage of manpower. So many people need to be isolated, and many people need to get involved to take care of others. Without the support from the central government, we won't be able to handle the situation. So this is a must. Apart from manpower, I want to make another point. Right now, there is another implementation problem. Concerning some medicines, if they are provided for the government through your own channels, then you can also arrange rapid tests. But then if we talk about another Chinese-based medicine, which is now very popular, I know that now departments still have a lot of rules and regulations so that community organizations find it difficult to distribute those medicine. So now, when we approve people from mainland China to come, well, if we are also able to approve the importation of materials or supplies for Hong Kong public, then that is also important. Concerning supplies like frontline supplies, for example, protective clothing and protective masks, I know that some government departments have made procurement, but can they arrive promptly? Are they available to frontline people? If we talk about cleansing people, security guards, and elderly care homes, well, government supplies are not in place yet. So I want to make these points, and I hope the government can pay attention, because we are talking about frontline people who are under the biggest risk. For example, carers in elderly care homes, if they can't get the protective supplies, how can they take care of and protect others? This is important. So these are my 2 points. My final point is, I hope that the territory-wide testing arrangement, as members said, if possible, can you please set the exact timing and details as soon as possible? Well, if you don't provide those details, I'm worried that there is changing messages and very confusing messages that will cause worry in the Hong Kong public. So can you finalize details and announce as soon as possible? Otherwise, if the messages keep changing, then the public will be unnecessarily worried. This is something I don't want to see. So these are my 3 comments. Right, thank you, Chairman. A simple follow-up concerning anti-epidemic supplies, especially those needed by frontline medical workers, carers in elderly care homes, cleaning workers, security guards in buildings where there are channels for those supplies to reach them. And then there is support from the mainland. And we ask our different departments to collect those supplies and then distribute them effectively. Concerning compulsory testing, I'm sorry. I believe members will continue to ask for details, but today we are not in a position to announce any details. As the CE said, at appropriate time when the plan is in place, then we will announce so that members of the public will have enough time to be prepared. Next, Kong Yuk-fun. Ms. Kong Yuk-fun. Thank you, Chairman. Now, I have a few questions concerning prohibition of gathering. Now, many Kaifongs told me that they cannot hold IO meetings. So, with this prohibition in place, will there be a ban on meetings effectively under Cap 344? And according to DMC, within 12 to 6 months, an AGM must be convened. And when there are special cases, EGM will have to be convened. For example, there are cleansing contracts that need to be renewed and they have to hold general meetings. So what will the government do? Besides, concerning the restriction of group gathering, what about subdivided units? Because for subdivided units, there are many households in a unit, and will they be subject to this restriction? And regarding vaccine pass, now for catering establishments, many have closed already. Even if they are opened, there are fewer and fewer employees. And I can see that the employees find it difficult to implement vaccine pass. So what will the government do? It seems that now they are very heavily burdened. And regarding compulsory testing, I always see from news that some households do not respond to knock on their doors. So what would be done to them? If there are people who do not comply with compulsory testing, now if the penalty is not heavy enough, in the future, when we implement territory-wide compulsory testing, then how can we make sure that people will comply? Sorry, Chairman, about wearing of mask. Now I know that people need to wear masks when doing exercises outdoor, but many people have taken off their masks or they only cover part of their face with a mask. So what will the government do? Many people still smoke outdoor. So what will the government view this thing? Just now, Mr. Kan referred to Cap 241. So I hope that the CS4A will be a bit lenient because I know that there are some volunteers right now. And when they go to elderly care homes, well, the CS4A have to rely on Cap 241 and be more lenient and open up more avenues so that more people will be able to take up voluntary work there. That's all from me, Chairman. Okay, Secretary. About 599G on restriction of group gathering. Well, the legislative intent is to fight the pandemic and to avoid group gathering of people. So if there is special meeting or if there are occasions when there may be risk of spread arising from gathering of people, well, we should try to avoid those. But then for special circumstances, for instance, IO meetings, which are urgent, then, well, people can consider video conferencing to achieve the same effect. And then concerning subdivided units, yes, Chairman, let me supplement. Under the law, we are talking about people in the same household. They are regarded as one household. So how do we define one household? People living in the same house or unit or same residence. So for subdivided unit, even though a certain unit is subdivided into smaller ones, we still consider that one household.
Next, Madam Kwon. Thank you, Madam Chair. First of all, I want to talk about 599L. The vaccination pass is in effect. We have repeatedly told the government officials this doesn't carry the tracing function. And you can't obtain people's addresses. So if you want to do data analysis to understand the pandemic situation in Hong Kong, you don't have the necessary tools to do big data analytics. I still think that we have many mainland experts willing to help Hong Kong. The explosive pandemic spread has proven that Leave Home Safe together with the vaccination pass are not sufficient. We can't achieve what we want. Since mainland experts are willing to help us, I think the government should adopt something like the health code adopted in China to do better surveillance work of the pandemic. I urge you to seriously consider that. Secondly, there are vaccinated citizens who have returned to Hong Kong. They have to go to the post office to go through certain procedures to obtain this pass. I think that is very backward. Can you think of something that can be done online without presence in person? We want to keep people home. We don't want people to queue up. And many post offices, due to lack of manpower or infected staff, they have already closed down. People go there repeatedly and they can't do what they want to do. Without the pass, they can't go anywhere. So I think these are things that you need to consider. You talked about rapid testing and the results have become available for quite some time, but the online registration platform is still lacking. So what should we do? You just ask people to wait and wait. For those who have been tested positive, they have to wait for many days to find out the results. And the hotline, you can never get through it. There is no support. And because of the rapid testing, there are many confirmed cases. They can't get any support either. So when will this be available? Perhaps you can do something with Leave Home Safe app. It's not that complicated. We don't understand why it's still unavailable. The hotlines can never be reached. We can never get through. So you're forcing people to go outside to buy food, to buy medicine, or ask for help from counselors. We receive 500 cases every day in our office. Our volunteers deliver medicine, rapid test kits every day to different households. We can't do this any longer. Many volunteers, many colleagues have already been infected. They have been isolated as well. They can't help. You can't just rely on community efforts. What about civil servants? You mobilize all of them to help those in need? Or are they simply staying home, working from home, and our volunteers are also running around? And people are waiting for rescue that will never come? You have to think about this. What about appointment making for the comprehensive testing? You have to do that well so that people can tell you of the special needs so that you can be better prepared. Well, I will choose the more important points for those who have been vaccinated outside of Hong Kong. When they come back to Hong Kong, you have to go through a certain procedure for it to be recognized. It depends on the case. So perhaps you can complete the procedure before returning to Hong Kong. I will go back and look into this. And then about the rapid test. If you're tested positive, that will be deemed a confirmed case of infection. We have only been launching that for about a week. Within 6 to 7 days, if you become negative, then it is concluded. Yes, the e-platform is a bit late, but the health department will spare no effort in setting it up. For those who have not registered the information, we will ask them to re-register. You don't have any support. Are you forcing people to go out? We do have support under the Department of Health, under the HA, for those who are going through quarantine at home or waiting to be admitted to the hospital. There are channels to seek help. Have you mobilized all civil servants to help those in need? Just answer me that. Perhaps you can ask the relevant bureau. It's a clear question, Mr. Choi. You are responsible. Have you asked all the civil servants to stay prepared to participate in this fight? That's the question from our member. Can you answer it? You can't just rely on councillors to help. In fact, you need to mobilize civil servants too. Why are we being volunteers? Many people are volunteers, and civil servants don't need to volunteer, don't need to help. I can give you one example. For those enclosed areas with compulsory testing, every time we need to send hundreds of people. So our colleagues are already working across districts. As a responsible bureau, have you submitted a request that all civil servants should be mobilized to participate in this fight? Have you put forth such a request? That's the question. I'm talking about your bureau. Don't pass it to others. I will bring your view back to Civil Service Bureau. Thank you. Ms. Chen Hao-yan? Can you hear me? Madam Chair, I need to take this opportunity to first say a few words to those working in hospitals. Patients are lying around on the floor. So I want to thank all the frontline medical staff under the hospital authority. Because of loopholes of government policies, many hospitals are currently facing this overload of patients. I believe you can do better in terms of triage. So first, a big thanks to our frontline medical staff. Secondly, today's meeting includes 6 pieces of subsidiary legislations. Hopefully, we can better regulate certain behavior, masking and the vaccine pass. But the government's measures in terms of fighting the pandemic is very regressive. So, Mr. Choi, think about that. What is regressive? This week, you are switching over to this voluntary testing. And you are not yet ready with a platform for registration. In the past, we will have a set of testing procedures and there were orders. But today, we're talking about people staying at home and they can report on a voluntary basis. People can choose not to report it. So they are isolated, they stay at home, trying to medicate themselves and treat themselves. Do they have medicine? Nobody knows. Do they have food? Nobody knows. And then one day they feel okay, they come out again. So everything is done on a voluntary basis. And now you don't have the platform yet for reporting. So for the 6 pieces of legislation, what is the spirit? We're using the antigen testing, and the platform is really lagging behind in terms of timing. It is already the 5th wave. We've gone through 4 rounds already. That is unacceptable. Secondly, someone already said, Mr. Choi, last time, when was it when you visited the market or a pharmacy? Every day, counselors and our volunteers, social workers are looking for medicine everywhere. We are not able to buy many types of medicine, cough medicine, and also fever fighting medicine. Do you know how chaotic it is? I think you need to stay more grounded. Thirdly, We are handling these cases every day. A huge stack. Family of 5, all positive. They don't have any testing kits. They can't go out to buy medicine. No fever fighting medicine, no cough medicine. So tell me, teach me, how can I help this family? And then you said you already have support teams. They've been calling the hotline for 3 days and 3 nights. No one picked up. How can we handle these cases? Do you expect counselors and community volunteers or social workers to deal with it? Are you even aware? Fourthly, about Leave Home Safe. The function is already void without any notification. 599L is about the vaccine code. Can you launch something like a Hong Kong health code, including vaccination record and the testing record? If you have a green code, you can go out. Can you provide one-stop service platform?
關於我討論嗰幾條法例咧，當然都
Concerning
係
the legislations we are discussing today,
法例去幫助防疫抗疫，我哋就推行啦。咁
well,
所以
we all along launch what is necessary to fight the pandemic.
處理嗰啲確診個案嗰個流程咧，我諗
Concerning
嗰個必然關係嘅，即係我
the procedure involved for confirmed cases, they are actually different. When it comes to optimization of testing and isolation facilities, we will review them and we'll try to improve them as soon as possible. As for medicine and food shortages, we totally understand. I have some personal understanding as well. Other than domestic suppliers stocking up, we will also rely on mainland channels.
發出要求請內地幫我哋
We will submit requests to the mainland side to provide different types of support. We have received very positive response and we will continue to use such channels to obtain more resources, including medicine. Leave Home Safe, yes. The system is there. The application may be different. But at different stages, the app is still playing certain functions. There are so many cases now, and there are asymptomatic cases moving around the community. Can you just rely on one e-platform to achieve early detection? Actually, the government is also encouraging the public to go to community testing centers to receive the testing. Thank you. Madam Chair, there is no medicine left. So, Mr. Chair, you're telling us to just stay at home and see if we die or we live. No fever fighting medicine. What should we do, Mr. Chair? Just tell us, how can we do it if you have a fever, but you don't have the medicine? Clinically speaking, if you have a fever, of course, one of the way is to place warm water on your skin or wipe your body if you are a child with warm water and drink more water. This is a short-term measure. We understand there is a shortage of medicine and we will try our best to find more medicine to be transported to Hong Kong. Mr. Qian? Mr. Qian. Thank you. Mr. Chui, we're talking about subsidiary legislations to fight the pandemic. What is really ironic is that we are all looking for painkillers and also antipyretics. Why? Because there is fake news. Sometimes there's rumor talking about banning people from going outside, and then people started scrambling for resources. Perhaps you need to come up with a piece of legislation to tackle fake news. Otherwise, before we are killed by the virus, we are hurt by fake news. We see surging numbers of infections. And I heard there is this new medicine which may save lives, but there is no news. Have you bought it? Are you unable to buy it? Or have you bought it but not using it?
Number 3, in Hong Kong, 75,000 elders have already taken, who have already taken 2 jabs, numbered 0, almost 0. This is a big problem. So now there are many people coming from the mainland and outreach teams. They should go to the care homes to vaccinate, to help vaccinate the elders. Of course, some have been confirmed they cannot get the vaccination, but some are not. So just do a rapid test. If they are negative, then just vaccinate them. Can this be done? I have been saying that there is the need to there is a need for lockdown if we have to complete compulsory testing within 9 days. Apart from buying food and medicine, people should not be allowed to leave home. So there should be work suspension and so on. And Dr. Sophia Chen said that she will not rule out this. And the CE said that to a certain extent, there would be some restriction on going out, but then there would not be lockdown. So the same points are made. Well, other people had already implemented lockdown, but then there is also some kind of movement allowed. Now, I think that her messages are contradicting one another. I think in order for that to be effective, I think the market and work should be suspended. Secretary, Mr. Tian asked about the medicine. I'm not sure which one he is talking about. Paxlovid, Paxlovit, Paxlovid, manufactured by Pfizer. All right, thank you, Mr. Tian. Now, some pharmaceutical companies have developed some new medicine. We understand that. Have you bought that medicine? Is it true you are not able to get it? The hospital authority is using these medicine, and they may increase the supply of such medicine if there's the need. Then how come fatality rate is going up? Well, HA colleagues have explained that on different occasions. The treatment efficacy, well, please tell me. So you are telling me that you have already bought this medicine and you are using it. Mr. Tian, please allow the secretary to answer the question first. Any points to add? Can you talk about the faked message law? Are you going to enact that law? Thank you. Thank you, Mr. Tian, for your comment. Right. Are you going to enact that law? We have heard your comment and we understand you. Thank you. Okay. Now it is my turn to ask questions. I hope that the Undersecretary is aware that we are talking about human lives and survival. 2 months ago, when we talked about survival, we're worried that many industries could not survive. Now we are talking about human lives. Those are not numbers. Those are lives. So today, when you gave answers to members, to be honest, I am very disappointed. Please do not refer to whether or not the financial system will continue to operate. Well, in the UK and in many other places, well, when they implemented a lockdown, they would not consider those issues. I have many relatives from the UK. And in the UK, people were allowed to get essential services. They can go out to buy food. So it seems that now you are still talking about the financial operation, and it seems that this is a very good excuse that you have finally come up with. So have you watched the television news? Please do not refer to the financial system as an excuse. That doesn't apply. Well, in other countries, when they implemented lockdown, well, essential services did not stop. Essential services, hospital, elderly services, of course, you have to take care of those elders. That won't be prohibited. When we talk about a movement ban, we are talking about we're talking about the situation where people can't go to work. So I think you are being tied by the system. Now there are more and more people passing away. So do you know people passing away? I have known too. Unfortunately, I know that 3-year-old child who had passed away. Please understand that the numbers that you announced have to do with family tragedies. We will give you a green light in relation to legislation. As Mr. Michael Tian said, I think you want to just stir up the public. I think all these remarks should be heavily punished. Now, you also affected Shanghai and Shenzhen. So if you are not willing to invoke the emergency regulation, well, you have not utilized it well. You only used it to defer CE election. So we have been under the pandemic for 2 years already. 2 years ago, I asked you to get people, medical workers from the mainland to Hong Kong. Now, vaccination is more important than territory-wide testing. But is it true that we should not do territory-wide testing? I'm so worried. It is very valuable if you are able to save one life. So how come you want to wait till the end of April? Then you may get 0 case. I think you are just turning a blind eye to the situation. We talked about yellow zone, red zone. Perhaps you can just ban movement partially. So we are really very anxious. Now the government is giving an excuse, and today government officials are not prepared for this meeting. This is not about laws and system. It is a problem with human beings. This is not a new issue. You talked with mainland experts. How much more time do you need for doing studies? I don't understand. You referred to financial operation. Is that just an excuse? So what is the recommendation of mainland experts, and how is it different from the Hong Kong experts in relation to territory-wide testing? Undersecretary, thank you, Chairman. Many people were ill or even passed away because of the pandemic. We find it regrettable, and I think there have been effective ways to tackle serious cases. And I think the most effective solution is vaccination. We have been lowering age limit, and as long as people are over 3 years old, they can get vaccine. So I think these are plans that we have put in place. I do agree that for elders getting vaccination, we should speed up the work. And within a short period of time, we want to enhance vaccination takeout rates among elders, especially in elderly care homes. For territory-wide compulsory testing, today I cannot give any detail today, but the government is very concerned about it, and we have to work out the very detailed plan. We have to consider it very, very carefully because we're talking about more than 7 million people, and it has to be done within a short period of time when the details are not ironed out yet. If or before we can allow people to be well prepared, I cannot give you some piecemeal information. So members, please be patient. When the government is ready, we will give a detailed account to members of the public. Thank you. Regarding mainland experts and Hong Kong exports, what are the main differences in terms of their judgment? So now, other people said that the earlier the better, and some of our experts said that we should wait till there is no more case. So it seems that we will be doing that only when there is no cure at all to people. Then of course it would be 0. But then this is not really a solution. So is there any difference in this regard between Hong Kong and mainland experts? A simple answer. I do not really know what recommendations mainland experts had given on this point, but then in relation to the overall arrangement to fight the pandemic and also the handling of data, they have given some suggestions, and we will follow things up. So mainland and Hong Kong experts will continue to work together. This process has not ended yet. I'm sure they will cooperate closely. Okay, I understand. One more point from me, and then I will pass to Dr. Lam. One more point from me. But they said as soon as possible. But you said You wanted to wait till the whole thing is over. Well, we need to save people. I want to see that you are saving lives. You should reduce the number of disease cases. Those are human lives. We will follow up each and every case to find out the problem. So please don't say that you want to allow more time. Time is used to save lives. Time is not for you to prolong your discussion. Next, Dr. Lam Chi-Yu. Thank you, Chairman. Under Secretary, today, we may get data out of territory-wide testing, and the number may exceed 100,000 by a large margin. And do we have enough isolation facilities? I don't need an answer from you to this question. In A&E departments, well, there are so many hospital beds, and all the beds are filled by elders. And when you go past them, they will just stick out their hands and ask for help. So for isolation facilities, can they be allocated to confirmed cases from disability care homes and elderly care homes so that they have a priority? Now, when it comes to grounding, when people don't go out, then the transmission chain will be broken. 10 days or 12 days, that will be enough for the incubation period. After that, you do a territory-wide testing. For those who have not recovered yet, for those who are still infected, then you can find them out. And then those from the care homes or isolation facilities can be discharged or sent to hospital. Then those confirmed cases can be sent to isolation facilities, and you can also suppress the pandemic by means of grounding. I think the administration should consider this. And referring to elderly care homes, I understand that there is quite big outbreak in some care homes, and now there are people doing vaccination. I know that vaccination cannot help the elders right away. Some are going to take the second jab like 2 to 3 weeks later. If people can't go to elderly care homes to do vaccination, then some elders may pass away. Well, I hope that this will not stop. Please do not stop vaccination work in care homes just because of the outbreak. And then for CAP 241, concerning medicine and antipyretics, I know that there are only very few here in Hong Kong. And there are European pharmaceutical companies offering paracetamols, but then they are not registered in Hong Kong. Can you make use of the exemption law so that those medicines can be made available to Hong Kong public? Now, there are two medicines, one from Pfizer, one from MSD. The MSD one is now in Hong Kong already, but for those two medicines, they should be used as soon as possible. But in some cases, people have already waited more than 10 days. And if you offer the medicine to them at that time, it will be too late. So can you consider how to better utilize such medicine? Offer the medicine when people are at an early stage of the infection. Right, thank you. Concerning care homes being affected, under the fifth wave, the number increased very rapidly. Based on Department of Health's data, more than half of the elderly care homes, well, no matter whether we are talking about residents or workers there, well, they are infected and the number is big. And in some cases, they do not have enough supporting facilities. They are not experienced. And they just send the elders to A&E because they don't know how to take care of them. In order to alleviate the situation in the past 2 weeks, some sort of emergency centers are set up to help. Now, to take care of the elders, we need bed spaces and also hardware and software. And I mean, community isolation facilities will not be good enough. So this is difficult here. So we will continue to follow up for elderly vaccination plan in care homes. We know that SWD and their working partners are working very actively. So even though there are cases in some elderly care homes, vaccination should continue. This is now being arranged. I'm sure they will expedite their work. And regarding the relevant medicine, we know that there is a shortage of antipyretic. No matter whether we talk about private doctors or hospitals, they are worried about supply of such medicine.
Concerning special medicine, with the development of the pandemic and also scientific data accumulating, the HA will definitely actively update guidelines to meet the needs locally. Thank you. Next is Leng Chi-wing. Thank you, Madam Chair. I would like to follow up on the content of the legislations. 599I has readjusted the penalty from 5,000 to 10,000, carrying a certain deterrent effect. But we still need law enforcement officers to do the implementation. Since this came into effect, how many fixed penalty tickets have been issued? What about the current mechanism? How can we routinely operate it so that we can prevent further spread of the virus? Secondly, 599J amendments. We've seen the fifth wave of outbreak, and we have seen many notices about compulsory testing, and later on, self-testing becomes viable as part of the exercise. So people just need to declare their results. What mechanism does the government have to truly monitor those who have been tested positive? And then some people during compulsory testing, well, they actually did not turn up for the appointment. Do we have figures? How are you going to follow up on that? How do you really prevent further outbreak of the pandemic? And thirdly, 599G concerning gathering restrictions. We are tightening such requirements, but actually still many people are gathering. Whether it is a restriction for 4 people or 2 people, how many government departments are really going to the front line to enforce the law so that we can effectively control the spread of the disease and prevent gatherings? Can we have some data? Fourthly, 599L. On the 20th, we have already launched a vaccine pass. Day 1, the execution was quite well, but after day 2, no one is there to enforce it. Some people who have not been vaccinated, they don't have cell phones, they don't have leave home safe. They just freely enter and leave the premises. So what mechanism do you have to truly implement the pass so that the pandemic can be better controlled? Finally, right now people are doing their own testing. If they are tested positive, they don't report it. Are there any legal consequences, any penalties involved? Mr. Choi. Thank you. Concerning implementation of different laws, actually, I have already mentioned there are 2 angles to any piece of legislation. We hope people will exercise self-discipline, and we also need to rely on penalties. I don't have all the enforcement figures, but concerning 599G, concerning group gatherings at different premises, even public ones, there are different people responsible for the carrying out of the work. They are the authorized people. They could be from the police, LCSD, or AFCD, but I can share some figures for your reference. For example, 599G, prohibition on group gathering, more than 200 inspection patrols, and close to 30,000 fixed penalty tickets have been issued. Many verbal warnings were also issued. What mechanism do we have? If we subject one building to compulsory testing before that is completed, we will only allow people to leave the premises if they have the confirmed report. And people who found it inconvenient before, they can do it now. If they insist on not taking the test, we may issue them a fixed penalty ticket or issue this testing order. Concerning the rapid testing, the latest round, yes, we have used many self-testing kits, basically because of the quantity. If we rely just on nucleic acid testing, the quantity is simply too overwhelming. So we need to find another scientifically viable option, which is self-testing. For the compulsory testing actions, they may take some time. So in between the test and the results coming out, people can rely on self-testing to satisfy the demand. Next is Mr. Wang Yunshan. Thank you, Madam Chair. Good afternoon, Mr. Choi. A few simple questions. First, about vaccinations. We talked about the past as well. Can you share a bit more insight? You said we are sparing no effort so that elderly people, their uptake rate can increase quickly. What are the difficulties? Is it manpower? Is it policy? Can LegCo help you in any way? Secondly, what about doctors and experts? They said that the second and third shot during that period, or that period can be shortened from 6 months to 3 months. Why aren't you doing it already? I think it's been 4 to 5 months since the second shot has been taken by many elderly people. They're facing high risk. They can't take the third shot ASAP. Third question concerning the vaccine pass. As Deng Fei mentioned, there are implementation issues. Then can we consider something different? Compulsory injections, for example, so that different clusters can be protected? Or are you going to offer additional incentives, economic ones perhaps, so that they can move along and get either the first injection or the third? Other than the vaccination issue, I also want to ask about some religious groups say that they have premises. According to the current legislation, they can't have gatherings. They want to turn them into isolation facilities. But when they approached the Department of Health, they faced many obstacles. So, Mr. Shui, can you expedite the removal of such obstacles so that religious and other premises, if they're willing to turn the facility into isolation facilities, you can actually help them? Mr. Shui, concerning vaccination, our plan for elderly homes in the past 2 weeks, the speed has been picking up. We've mobilized many doctors. They've gone to the elderly homes to give injections. And then recently we have launched a new way. If the doctor on site assesses that the elderly person is fine and he is in his right mind, and with the consent of the guardian, injection will be given. So we are already removing many obstacles. Secondly, if any group has a venue which is quite large, which can be turned into isolation facilities, we need to go through an assessment procedure. Not every place is suitable, even if it's a large place. We have to consider other supporting facilities. We thank them for their kind thought, but the assessment procedure cannot be skipped. What about second and third shot? Can we shorten the time between them?
方案有4、5個方案咧。
There are many different options for different age ranges, whether we shorten the time or adjust the flow of injection. But later on, there will be an announcement.
實行嘅措施咧，盡快。
We know the principle, but we will make timely announcement of the actual arrangements. Will you make it compulsory?
即係疫苗都係一個藥物嘅一種啦。
Well, vaccines are a kind of medicine. In special clusters, if the injection rate, take-up rate is low, and we use administrative measures to increase that, for example, we can resolve the situation in elderly homes. We don't need to legislate to achieve that. So no such order has been placed. We don't have that consideration at the moment. Mr. Ho Kwon Yew. Mr. Ho Kwon Yew. Thank you, Madam Chair. I was thinking about a lot. I totally support the urgent measures under 599 in relation to the premises and the vaccine pass. Everything is fine because on the 10th of February, you already gazetted and implemented them. But what is the date? 5th of March. How many people have died since the 10th? Didn't you hear from Chairman Xi about the arrangements and measures? What we're looking at is water under the bridge. Nothing wrong with these things. We're all concerned about things lagging behind. So move more quickly, Mr. Choi. We're not really talking about 599 legislations, legislate before scrutiny. We don't need to discuss all these things. What is truly lagging? Injections, and also the measures mentioned by Chairman Xi. You are not doing that. Control the pandemic as far as possible, mobilizing all possible means and resources. We know about the measures that are necessary. The Bureau should have moved swiftly along, including 241N, that should be incorporated into today's meeting. Issue the information and then on the next day, gazette it, and on the next day ask us to come out to scrutinize it. That is moving along quickly. This is from the 10th of February. We are looking at the content on the 5th of March. It's a waste of time. Everyone is so tense and nervous. I admire you, Mr. Choi. Very often there are issues coming from the community, and you can act swiftly. You have the talent, you have the ability, but today you are bound by the rules. So Secretariat and the Bureau will have to consider such urgent legislation. We need to legislate and then scrutinize. After we endorse it today, call for a meeting tomorrow. Then we can act alongside you immediately. That's the first point. I want to make this point clear. Don't have meetings for the sake of meetings. Secondly, every day we have 50,000 infections. How do you ensure that we are going along the two assurances from Chairman Xi? How to ensure people's health not getting infected? We are failing. We're missing out in terms of the timing. There's a lack of coordination. We can't even purchase medicine in the market to fight fevers. What about the Chinese herbal medicine? Just place the medicine on the schedule and approve it. Why are you testing the content in the lab? So many people have already died. So please do that well. That's all I want to say. Mr. Choi, please.
Thank you.
Concerning the suggestions,
即係喺立法局
Perhaps we
嘅
can
我諗
discuss the legislations at LegCo sooner or follow up sooner. We're willing to do that.
The second question is about how to make available more medicines. We understand that if the medicine is already registered in Hong Kong, then we will try our best to strive to shorten the manufacturing and delivery process of the medicine. This is a very effective way to increase the supply. Thank you. Chairman, I want to add a point. Under Secretary, I know that you have your difficulty. However, well, there are so many of you attending the meeting, but there is only one person doing actual work. So can the Director of Health answer me? How come the medicine cannot be approved right away? If you think that the medicine is not reliable, just try it yourself, and if you don't die, then it should be fine. I have 2,000 boxes of medicine in Shenzhen, but then you are not giving approval. So you are, well, if our volunteers are in possession of the unapproved drug, then they are against the law. We are talking about saving lives. Can you approve the medicine as soon as possible? The person in charge may ask us to approach Yao Tanghua or his wife and so on. Okay. Can you give approval right away? Okay. Okay, we have heard your point very clearly. Okay, Director of Health, Under Secretary, can you answer the question? Well, let me repeat my points. Concerning the handling of medicine, it is different from handling other supplies. For medicine, there is safety consideration. So that's why in the whole world, there is a registration process to ensure quality and safety. Well, members are concerned about a certain medicine, and in Hong Kong, well, we do have some registered medicine. We will try our best to strive for faster processing of those medicine so that they can come to Hong Kong. Under Secretary, we are talking about saving lives. I have experienced saving two families. I have referred one of them to you, a pregnant woman who has been pregnant for 8 months and a 2-year child. We have all handled those cases. Now we are fighting a battle. We are fighting the pandemic, and we want to save lives. Please be more flexible. Please do not be bound by the system. Remember, the numbers that we announce every day refer to human lives, okay? All right, we are done with the first round of Q&A. Now we have the second round. Let me read out the names. Let me tell you the timing that I have in my mind. For the second round, Siu Ka-fai, Kang Wei-mun, Elizabeth Kwok, Michael Tian, Kong Yok-foon, Leung Wing-kin, and Lau Mei-fun, Lam Chi-yun. Any more members who would like to speak? Hands up, please. Now, we are discussing the policy points at one go. If you still want a third round of Q&A, I will consider the number of members first, and then we will move on to clause by clause. We may not be able to finish the work today, and at appropriate times, we may extend this meeting. But I would like to say to the Undersecretary that you should take note of all members' points. In fact, most of the questions are left unanswered so far. And later on, members may continue to ask follow-up questions. So please try your best to dig out some better news from your mobile phones, perhaps. Today, I don't think we will not be able to complete our work, then we may need one more meeting. Siu Ka-fai, Mr. Siu Ka-fai, thank you, Chairman. Right now, if you go to the supermarket, you have to scan Leave Home Safe. For me, yesterday, I observed the situation. Among 10 people, there are at least 2 to 3 people who did not scan the code. They just walked past. I do believe that they have the vaccination record because the vaccination rate is more than 95% for those in their 30s and 40s. Perhaps no one has reminded them. So are you going to put up some API to announce people? Otherwise, they will be breaking the law inadvertently. There is not enough right now because some people may be infected and their family members and friends may be infected. If a person is infected, then he will be able to show evidence to his employer. If he hasn't, well, he has just got a rapid test, then will he need medical record? Will he need a doctor's certificate? And in some cases, family members are not family members are infected. So how can they present proof to employers? Then concerning medicine, well, some time ago, I donated medicine to some people, and I personally delivered the medicine. And when there were too many such cases, I used Shunfeng's service. After this meeting, I have to send supplies to some other people. The hotline is always where people can't get through. And for public organizations, well, have you stored up a lot of medicine? Can the medicine be made available to the public within a short period of time? Then when the next batch arrives, then the supply situation will not be that tight. Under Secretary, concerning the use of vaccine pass, at the beginning, perhaps the situation is not very satisfactory. We'll remind the premises to do a better job. The second question is about rapid test. Well, there is a pause of 5 seconds. The connection was broken for 5 seconds. So you may be asking about a proof of infection to be presented to the employers. And according to CHP, when the new electronic platform is launched, then certificates can be issued to prove that a person has been infected. And the third question is about medicine supply chain. Yes, it is tight. We do understand. You asked about how can HA's medicine be made available in the market. Well, this is a big issue. We can't just say yes or no. I think we have to give priority to patients within hospitals. Okay, thank you, Chairman. Ms. Kan Wai-mon. Thank you, Chairman. Chairman, my first point is I want to solemnly say to the administration and civil servants and the whole Hong Kong public that after the electoral method is improved, please rest assured that LegCo is no longer a rubber stamp. Just now, Mr. Ho made very emotional remarks and touching remarks. Now, today we are scrutinizing the regulations, including 241N. It is not only under the Food and Health Bureau. Well, today, I think the Undersecretary faces a hard time. So I will ask the related bureau. I will pass the points to the related bureau. So I hope that the administration wing will pay attention to the legislation that we are scrutinizing carefully. You need to find the right persons in charge so that they can give detailed accounts to the public. This is about accountability. This is my first point. Second, well, I have a question for the Undersecretary. Just now, you referred to 599L vaccine pass, and there are some inadequacies about it. So can you promise that you will do a better job about epidemiology, tracing, and investigation? Now, among the 5 task forces, well, the Food and Health Bureau is responsible for epidemiology. When we scrutinize vaccine pass, we have to be responsible. So please promise us that you will continue to do tracing and the health code. Unless if you have a better solution, then why don't you do tracing and work on health code. Secondly, about 599G, it reduces the number of people from 4 to 2 in relation to prohibition of group gathering. And you said that all these measures will be valid till 20th of April. But according to the law, you need to extend the regulation once every 14 days. Now, for the 6th CE election, it is also based on 599G that the nomination period will be extended from the 3rd of April to 16th April. Yesterday, we had a discussion with the Constitutional Affairs Bureau, and we made a similar point. And today we see another bureau. Now, under 599G 8 capital D, the CS4A has the power to allow multiple household gathering. So when we consider fighting the pandemic and we want to make sure the CE election can take place as scheduled, I hope that the Bureau will take all these points into consideration. Thank you, Chairman. Thank you, Undersecretary. Thank you. Regarding the implementation of vaccine pass, I said just now that at the beginning of any law, especially this time, so many premises are involved. Some have to do an active check, some passive. So at the beginning, there might be inadequacies. Certainly, we will continue to review the situation and enhance it. Regarding epidemiological survey, Ms. Ken is right. One of the task forces comprise mainland and Hong Kong experts, and there are 3 batches of experts who have come to Hong Kong. The work is underway, and in between the 2 groups, there's a lot of communication and actual information exchange. They'll continue to follow up. Number 3, 599G. In the future, on different occasions, for example, during election, how can it be applied? Of course, in the future, when this is implemented, it will be considered. Okay, thank you. Right. Next, Ms. Elizabeth Quad. Yes, thank you, Chairman. Just now, the Undersecretary answered members' questions. The answers are not clear. For confirmed cases, no matter whether the notification comes from the government or people know that they are infected by way of rapid test, they can't get any help. They can't get through the government's hotline. And one resident told me that he has been calling the number all the time. And finally, he could get through. And the answer he got was that no help could be given to him. And he could go out to buy things. And there is no law prohibiting people to go out to buy food or medicine. And he told us so. So, is it true that all infected people can go out to spread the virus? Are you really controlling the pandemic, or are you just allowing the pandemic to spread? If people go out to buy things, you said you would make sure stable supply of medicine. Now, we ourselves experienced the case that we could not buy any antipyretics. And there are many Chinese medicine that can treat the disease. For example, Lianhua Qingwen Jianang. Now, there are mainland versions of the medicine. You do not allow us to send it to other people. And just now, you could not give an answer to question. So how can you really help needy people? How can people save themselves? Just now, I received a case. There's a man who has got positive result from rapid test, so he's confirmed, but then he did not want to spread the virus to his family members, so he did not go home. He just slept in the warehouse of his company. The environment is very, very bad. He wants to go to isolation center because there are both elders and children at home. They are not vaccinated, but they but he has no one to help him. He sought help from us, and whom can I approach? Can I ask you to help these needy people? If he just goes back home, and if the virus is spread to the elder, then who should be responsible? Please tell us what to do. Well, even if members work very hard to send out medicine and supplies, well, we cannot get the supplies available. So what should we do? Now, many volunteers of the DAB are infected already, and we have no regrets, but then we can't buy the supplies or the medicine. We can't buy the Western medicine, and we are not allowed to use the Chinese medicine. So we really want to help members of the public. We are very anxious.
Mr. Choi, thank you, Madam Chair, and thank you, members, for your views. We fully understand that there are many services facing serious bottlenecks. Madam Clerk, we are aware of the issue you presented through different channels. We are hoping to do different arrangements to tackle the situation. When it comes to the support, when there are so many cases, we are trying to provide more services. For example, at designated clinics, there will be more services available. Increase manpower to take calls on the hotline. We know supply is limited, but we will try to increase them as far as possible. Mr. Choi, you just repeat yourself time and again. I have told you a case. Tell me, how can I help that person? This person who's been tested positive and sleeping in the warehouse every night. For special cases, we can deal with them after the meeting. It is not special at all. There are many similar cases. People are sleeping on the streets. They dare not go home. We can tell you this is not special. There are many cases, just like this one. People can't go home. They don't want to spread it to the family. How can we facilitate them to be isolated? Can you mobilize some hotels or schools or other community facilities and just place them there first? Gradually, we are arranging hotels and other facilities. For example, the one in Qingyi, we do have facilities. I'm sorry, Madam Chair, but there are people who have been waiting for 10 days. And they are now negative, and they are getting phone calls being told that they will be taken to the isolation facilities. So people who need to be isolated, they are just waiting around, and those who are already recovered, you want to isolate them. There is a serious mismatch and lagging behind of your resources. People can't save themselves. Everyone just feels so helpless. Mr. Choi, we will continue to negotiate and communicate with the Department of Health. Thank you. Is it Michael Tian? Thank you, Madam Chair. Mr. Choi, I will ask them one by one. Concerning the 9-day-long compulsory testing, the CE said that people will have to stay at home. There will be restrictions on going out, but there is no mentioning about territory-wide suspension of work, except for emergency related. And what about comprehensive ban on dining in? She talked about economic impacts that will be huge. But now, even the commercial world is saying, let's cut short the pain. The government should be right ahead of everyone in terms of urgent needs. If you want to close off the city or suspend all the work, normally the commercial side, the businessmen will object. But today we are asking the government to cut short the pain. And now you're saying we're worried about economic impacts. It's too ironic. just take it back to the CE. But I do want you to respond about confusion of data. Many people have asked civil servants to come out and fight the pandemic with us. They can do so by working from home. You can take hotline calls, right? Because today you can't get through. You have so many civil servants working from home. Ask them to help so that they can go online, they can look for the information, and people will be so grateful. Sometimes it's something very simple. Just leave a telephone number. Department of Health can have this place that is centralized. There is a channel for people, the civil servants, to inform you of the answers to your questions. They can tell members of the public in person what the answers are, and people will be so happy because you don't have enough people, enough experts to answer all those questions, but you can have civil servants. If their answers online, you can guide them. Otherwise, you can use that brain, right? And you consider that you will win many points. And what about elderly homes? They need people to go there and give them vaccinations. And the children originally opposed to vaccinations, but now they agree. Many elderly people in these homes are still not yet infected. Can you arrange or mobilize people to inject elderly people? They want the vaccinations. You are not forcing them, okay?
咁關於田議員第二個意見
Thank you.
咧，動員多啲人去參與一啲。
You talked about mobilizing more people to participate in different services. Yes, we understand that. And we can pass the information back to the Bureau. As for the vaccination take-up in elderly homes, it's been increasing very quickly.
都積極參與呢個運動，咁所以咧喺短期內
Different organizations are actively participating in such an exercise. So we can do it very soon. Any timetable, please? Do it until September, December.
政府希望喺3月之內係即係去。
But within March, we are hopefully within March, or within March, not within 3 months, right? Within March, you can complete the rest of the elderly people. 70,000 of them, yes? Yes. So you can deal with all of them, yes? For those who want to get the vaccinations, you can give them the vaccinations, right? Okay, that's your undertaking. Within March, not within 3 months, but within March, the month of March. Just over 20 days left. Okay, thank you very much. And think more about the hotlines, okay? They will save lives. Next is Madam Kong Yafun. Thank you. I wanted to ask about compulsory testing order in Tin Estate. They completed the action and 31 people did not receive the testing. 5 buildings being closed, 1,000 positive cases already. So just in case, for those who do not comply with the order, many of them are actually positive. They're infected. If they go out to the community, it would cause huge problems. If the order is not implemented on a compulsory basis, it's a huge issue. What about people scrambling for medicine? Why are they doing it? It's because you don't even know when they will be replenished. I tried Shao K1 all the way to Kennedy Town to look for this headache medicine. I couldn't even get one pack. I went to Changchao yesterday. Painkiller and also antipyretics. None is available. When can we buy them? When can you replenish the stock? And what about the platform? Self-reporting platform. On Monday, is that this week? And then it's already the afternoon of Friday, another press con is being held. When will they be ready? You said there are too many cases and we can't do it. What about in South Korea? They have tens of thousands of cases. How are they able to do it? And what about injection in elderly homes? Towards the end of last week, elderly people were willing, their family supported that. They got the first shot, but no one is there to give them the second shot. If they take the shot today, for example, in March, after such a long time, will the second injection be viable, or do they have to take the first one all over again? I got this case yesterday. There's no follow-up for the second shot, and the elderly person already died yesterday. That is really, really sad. It's a tragedy. So please follow up. Let's stop the clock. I have discretionary power to extend the meeting by 15 minutes. We can do that twice. So after the second round is completed, we will end today's meeting. Together with our meeting next week, that should be sufficient time. Mr. Choi, please. Concerning restriction on testing, a notice has been issued, positive cases, penalty arrangements, or an order for compulsory testing. It shows that in every step of the way, there is this mechanism for those who have not yet been tested to do it. And then the supply of the medicine, I understand many people are concerned about this, and I totally understand, because medicine that we use all the time are still lacking. So the voices from the public and also some doctors is the same. So we will try our best to identify suitable medicine for the public to use. And then the e-platform for rapid testing, the Department of Health has been explaining it will be launched as soon as possible. This is a huge system and there's a lot of supporting arrangements, who has been tested, and there will be questionnaires sent to them. And it's basically a very complicated system. We have to perfect it before we launch it. Finally, elderly homes, vaccinations, or anyone who wants to be injected, if the timing between the shots has been rather long, it's okay, just take the shot anyway. Thank you. Next is Mr. Yang Wing-kit. Thank you, Madam Chair. I also want to follow up on the medicine issue. We have already heard about this very real problem. Mr. Choi, everybody knows we don't have enough antipyretics, especially for children. So we want to know one thing. When are you ready to launch these medicine into the market to assure people? If you can't do it, please ask the central authority and buy the medicine and bring them to Hong Kong so that we can distribute them. We want to know when. Don't tell us you know about this problem. Everybody knows there's a lack of antipyretics. Secondly, what about the oral medicine to fight COVID? Well, we are using a brand at the moment, but since the 5th wave, more than 1,000 people have died. Why are we still not using such medicine to fight COVID? The oral medicine. Every day, people are dying. How can you be accountable to these people? I hope that something can be arranged ASAP. Why not import some oral medicine from mainland China? Why do we have to buy from MSD and Pfizer? Whatever the quantity we need, I'm sure our motherland will support us.
Undersecretary, member talked about antipyretics. I do understand the need of the market and of the public. We will try our best to secure more supply. And concerning the oral medicine for COVID, well, only professionals can use such medicine, and the public healthcare system will establish treatment method based on scientific evidence. When there is new scientific evidence, definitely they have to update the treatment protocol. The government will tie in our work with that. And then if there are new medicines with scientific evidence to alleviate the serious cases, we'll be more than happy to explore. Now, I want to follow up this. Right now, the MSD medicine is here already. When will it be used in treatment? This is the question of Dr. Lam Chit-yun. You said you will work on it, but when? Are you going to wait till the end of the 5th wave and the beginning of the 6th wave? You are falling behind, Undersecretary. Undersecretary? When there are more and more scientific evidences and data, we can consider different treatment methods. Of course, we need experts' advice. The government will work on that and provide resources to buy the medicine so that the right clusters can get the medicine. Undersecretary, the MSD oral medicine is here already. When are we going to use it? That's my question. If you can use it, you need to be fast. Please don't wait further. If you need to wait for the procedures, why do you buy it? Since you have bought it, definitely there are all the necessary clinical evidences. In overseas, the clinical tests have been done. Are we going to wait till more people die before we use it? This is not right. Yes, please continue. I want to clarify. The medicine is already in use, but the HA has some guidelines on which groups of patients can use that medicine. So they are still following things up. Okay, my turn now. First of all, I want to say that time is everything. Right now, the emergency law is in place already. If that is still not enough, then I think the Hong Kong national security law will have to be applied. So Article 3, you are now threatening national security. Shenzhen, in Shenzhen, there are many imported cases from Hong Kong. So this is not tolerable. I think no delay can be tolerated. Then for territory-wide testing, I find it unacceptable if it has to be deferred till April. So to put it more bluntly, you want to wait till all those people die. Then of course there won't be cases. That is not possible. Even if a few 100,000 confirmed cases are discovered, we have to face up to those scientific numbers. And the confirmed cases should not be allowed to go out. So please find a solution to do the testing so that people know their condition. They should not infect others with weaker immunity. Now, if you allow people to go out till the end of April, then of course we will see a zero number because those people are not rescued. This should not be the society that we should see in Hong Kong. I have tears in my heart. I am really saddened. Now we are under the 5th wave, and when the 6th wave comes, I hope that you would have done a complete review. Now, with the fifth wave, so many people have died. I don't think you have learned. You just put the blame on the system. Timetable, roadmap. I'm sure you need a plan, which should be there earlier than the virus. You have seen what our country has been doing. So why can't we take reference from them? In the past 2 years, well, you have no solution at all, and you have no anticipation. This is not acceptable. So many people have died, and right now you still don't have any solution, roadmap, timetable. Well, no matter whether you are talking about semi-grounding or not, just take the first step. No matter which brand you are talking about, I have ordered a few hundred pieces of protective clothing, and the price is 3 times lower in the mainland, but then they cannot clear customs in Hong Kong. I want to offer those clothing to volunteers because they are helping out the carers in elderly care homes. Many of them are infected. This is the fact. So we must protect the volunteers. I wanted to order a few hundred pieces. In Hong Kong, each costs 98, and in China, 28. But then those are not allowed in Hong Kong. The same goes with the medicine. The same situation applies. I have given those medicine to 2 families. They have no drug. And later on, they recovered after taking my medicines. So they said that we have saved them. So it is really saddening for us to play this role. I think we need the government to take the lead, to take actions. Undersecretary, I think you know yourself. Many voluntary organizations offer you the venues. You just need to take the lead and take actions. Then everybody will be willing to cooperate. I think you have heard our points. You know that we are sincere. We don't want to repeat our points. I hope that your professional teams can hear us. We can't accept territory-wide testing in April after everything is over. I have received so many comments from the public. I said the 3rd week of March, and they also challenged me. He said, well, those are foreigners. They are listening. So I have received 3-4 messages already. They all said, as soon as possible, don't listen to the government. Don't procrastinate. Don't delay further. The infected patients are going around in our society. Whether or not there should be grounding, semi-grounding, yellow zone, red zone, whatever. Well, in some districts, there is not a big outbreak. I'm sure you are able to do the work. Please don't defer. I said the 3rd week of March, I am already heavily criticized. Some foreigners are taking flights to leave Hong Kong because they don't trust this government. Please review. In the past, we did a good job. So we are proud of our professional team and professional decision. How come today we have changed in such a way? There are messages in Chinese and English. I'm not cheating you. A group of councillors wanted to place order, but those products cannot clear customs. I think that's the purpose of the emergency law. So please think why we ask for emergency law. Otherwise, I will ask you to invoke the national security law. If you don't want mainlanders to do the work, please do it yourselves in a nice way. Undersecretary, I really am going to make this suggestion. If you don't take any action, I will recommend in my way. And you have to give up your lead. Don't only criticize or blame on the system. Thank you, Chairman. Thank you for your comments and your concern about the whole matter. Now, for the territory-wide compulsory testing scheme, it will be implemented, but for the details, at this moment in time, I don't have the information. I believe the public is concerned. At appropriate time, the government will give a detailed account for members of the public to be well prepared. All right, one more point. TAP 599 is enough to implement territory-wide testing and tracing and vaccination, and you admit that, but then you have not done anything. And so we are forced to use the emergency law. I tell you now that the emergency law is enough. for you to take up the work, even though there may be system difficulties. If you still don't take action, then I will strive for invoking the national security law to fight the pandemic. Well, you have not shown us your ability to save lives, and we cannot allow the situation to continue. We can't accept continuing studies on your part. So I hope that you can hear me. I will only give you a few days, then I will move or I will propose a solution. There is the law, and please use it. Dr. Lam Chi-yun, please. Dr. Lam, thank you, Chairman. The same point about medicines. The Undersecretary is doing the work. I guess you understand my point. I think we all understand that in the hospital, there are very serious cases, and when remdesivir and steroid is being used, not the Pfizer and MSD medicine. Those two medicines are used in high-risk people and at the early stage of infection, not when they are hospitalized. Those medicines are to prevent serious complications so that they need to be hospitalized. So right now, the law refers to a named patient basis. And in those cases, the medicine can be imported to Hong Kong. But then in that case, the medicine cannot be used to save the needy people in the community. So through CAP 21, I hope that the medicine can come to Hong Kong as soon as possible. And we hope that the medicine can be used in the community and the designated clinics. About antipyretics, this afternoon I've been working, and some pharmaceutical people have already identified some paracetamols in other countries that can be delivered to Hong Kong. But then those companies are not the pharmaceutical companies that we have normally procured medicine from. But then we are in the discussion process. So concerning import of medicine, I hope the government can listen to people's comments. I'm sure the administration, including the D of H, are working hard on that. I want to say to the public, for antipyretics, these are just very ordinary drugs. I'm sure they are available. Please do not keep too many at home because they may expire. And if you take too many, if you take too heavy dose, well, you will suffer from kidney and liver failure. Those cases may be fatal. So please do not stock up so many such medicines at home. That's all from me. Okay. Undersecretary, do you want to respond? Please. Thank you, Chairman. Thank you, Dr. Lam, for the information. He really understands the need for the medicine concerning the specialist medicine to be applied in people in different stages of the illness. Well, we have to keep up with time. WHO, from time to time, issues guidelines on medicine, use of medicine to alleviate the illness. We do understand. So everything is based on experts' views. Thank you. For the pharmaceutical field to try their best to identify the necessary drugs. I'm sure when there's the need, they will be willing to help. Okay, thank you. Let me announce again, if there is no objection, I will extend this meeting for 15 more minutes so that all members can ask their questions. So, Ms. Chen Ho-yan, please. Thank you. Thank you, Chairman. From the beginning till now in this meeting, well, I really have a headache. We still don't have antipyretics or painkillers. Now, just now, the Secretary told us that apart from taking medicine, we can also wipe our children's bodies with water, and water can refresh us. I hope that the Undersecretary can be clear-minded and give us an answer. Now we don't have any antipyretics or any other medicine. Can you give us a name list? 2 years ago, there were no masks. And then there were conscientious shops offering the mask. Okay, can you tell us that this is only a short-term problem? Please give us a list on where we can get antipyretics. Please give us a list. Everybody approaches us, or please give us a hotline for our residents to buy medicine.
Secondly, about the territory-wide testing, the expert team from mainland China is coming to Hong Kong. We also have a local team. Is there a lack of consensus between the two teams? Therefore, you're not doing it at the moment. You talked about isolation facilities. Many people are actually isolating themselves in situ. So how many spots are you going to construct before you actually launch the comprehensive testing scheme? That is the effective way to cut the spread of the disease. If in a few days you see a smaller number, perhaps it is not a real drop, but it is not the real number. So mainland experts, have they told you when you need to do the territory-wide exercise and how that is to be done? I want to hear about the expert advice. Thirdly, you talked about chaotic information. Let's not talk about fake news. Who is coordinating this? On the 28th of February, during the press con, at 4:30, 2 doctors are doing a press conference. And at the same time, the CE is issuing a statement on TV. And on the 3rd of March, again, you had a 4:30 press conference. Dr. Yun Kwok-yung at the same time met with the press from this elderly home. How can we receive the necessary information when you have internal arrangements for press conferences? You do not coordinate. Because 4:30 press con is very important announcement. Don't blame people for getting the wrong information. You need to do better in terms of coordinating. Thirdly, all the hotlines, you can't get through. Can you add more manpower? Can you add more hotlines to receive inquiries instead of passing the buck on to the community side? We're willing to do it, but we can't cope. There are too many cases. Can you tell us? Can you add manpower to resolve this hotline issue? Mr. Chui, thank you for the views. Medicine supply, we have already talked a lot about that. So far I have nothing to add. If there is information that can facilitate purchase of medicine, we can think about how to provide the information. And I don't have information in relation to mainland experts and what the views may be concerning territory-wide exercise of testing. But for such a large-scale activity, we will make timely announcements. Different press conferences, the timetable, if they're well coordinated, that's ideal. But of course, people can also refer to the recordings afterwards. They can still receive the information. We understand it's hard to get through to the hotlines. Hotlines on different platforms. I will urge them to increase the manpower to deal with a huge demand. Thank you. Well, I'm sure you are aware of the advice from the mainland experts. I'm just asking about when and how we can do territory-wide testing exercise. We should know what advice has been given by the mainland experts. Why is the government being so undecisive? Why can't they tell us what the advice is? What are you trying to hide? I have asked the same question, actually, Mr. Chui. This is a very strong message. Please answer. Any discrepancy in the views? Well, Madam Chen talked about the information of the testing scheme from the experts. I don't have that information. Thank you. Well, I'm really unhappy. Why are we having this meeting? If Mr. Choi doesn't even have the advice from the mainland experts, we need to know he doesn't have the information. Understood. We will submit written requests to the government to be honest to us, because we receive great expectations from the public in terms of territory-wide testing. Everyone prefer to cut short the pain. Even before 21st. So let's submit something in writing to the administration concerning the date of the territory-wide exercise and the two teams of experts, what are their views and whether there are any discrepancies between the two teams. Why isn't it decided? We just hear rumors from the media. A written request. Secretariat, please mark that down. Next, Mr. Ho Kun Yu. Thank you, Madam Chair. Again, I want to stress. I know Mr. Choi is trying his best. I also understand that he is not able to provide all the answers to our questions, but we've been fighting the pandemic for such a long time. 16th of February, strict order from the central authority. Instructions given. In the past dozen days or so, we have seen national medical team. They have come for 3 weeks. So many members have reasonable expectation. Where is this going wrong? Where are the problems? It's not just about Mr. Choi. Is there a lack of coordination, a lack of center at this moment in terms of fighting the pandemic? Is it a disease prevention branch or Sophia or Lee Tak-hoon doing it? Or is it Chang Wei-kwok doing it or CA herself doing it? We don't know the answer. Who is the ultimate coordinator? That's the first problem. When you come back next time to talk about 241N, I hope 241N formulated on 24th of February, our CS has been authorized by the CE, but nothing else happened. There should be many things being approved, exempted, allowing mainland medical personnel to get things done. Please give us the update. Next time, when we ask to see 241N, tell us how many exemptions have been issued, how many problems have been surmounted. You need to declare these clearly and openly. Secondly, concerning the urgent legislations, I'm not interested in talking about those 6 points. This meeting is not about that. Next time, 241N, the first provision, it aims to prevent the specified diseases in terms of their spread and necessary treatment for the patients and facilities and things to consider. Under such premise, can we ask about the Lianhua Chinese herbal medicine? I have 2,000 boxes. Can I get exemption right away so that I can distribute them to members of the public? You got 50,000 boxes and you handed them out to 25,000 members of the public. We have a population of 7.5 million. So that means in every 5,000 people, 3 of them will get it. How are they going to share it? It's about basic logistics. You handed out 50,000 boxes. Why don't you procure more, import more? So I want to ask now, and then issue a letter for John. Are you going to approve it? The stock is there waiting by the border. Thank you. It's now 4:54. If you do not object, I want to extend by another 15 minutes. We have one additional member asking for the first time. I want to give them the opportunity. If there is no objection, after this meeting and all the questions put forth to the administration, please go back and respond, some in written form. Next, Mr. Wang Yunsan, second round. Thank you, Madam Chair. Mr. Shui, good afternoon. Today, we want to express this intention to fight alongside with you. But sometimes, well, at least for myself, I feel that I've written many letters, but no reply. It's like a one-sided relationship. I don't want that. I want us to fight in the same battle. So many people are saying, oh, you said things that is not relevant to your bureau, but they are actually. For example, the creation of testing positive, and on day 4, they get the wristband, or even the info pack is only received on day 10. Is there any performance pledge, wristband or info pack? Or are you going to try your best within a certain timeline? And then Dr. Yun Guoyong said, private hospitals, most of them do not receive positive patients. That is morally wrong. What Professor Yun said has been followed up by members of the media. It is also under your remit. Have you thought about using the power in your hand to mobilize private hospitals, more than 5,000 hospital beds, so that when the public hospitals are about to collapse, can we get some sort of assistance or relief with the help from private hospitals? Many people want to see a doctor because they need the medical certificate. In Singapore and the UK, there are clear government guidelines saying that once you are tested positive, including self-test kit, you don't need to obtain the doctor's certificate. The employer will have to honor the existing paid leave, paid sick leave. Are you going to consider arranging a guideline that is similar to that? Thank you. I will take the third question first. I understand that since the outbreak of the pandemic, many people who have to go to work, they are concerned about the need of some sort of medical proof to get sick leave arrangement. We are aware of that, and we have done follow-up. The Labor Welfare Bureau is about to amend the law so that for legal reasons, if someone needs to be isolated, that should be considered as sick leave. Secondly, how is that proof going to be sent to the person? The DFH will follow up, especially in relation to the use of antigen test, self-test. How do we use the new system to send the proof to the people involved, and they can then forward it to the employer? And after amending the law, we can satisfy all the needs. Secondly, about private hospitals. They are important resources. They have 4,000 to 5,000 hospital beds. Some have a few dozen, some have more than 1,000. So from different angles, we are beginning to negotiate with them on how they can help public hospitals. For example, patients who are recuperating, or people who have been tested positive, who are confirmed cases. And what about our clinic services? And then about the sending of wristbands and info kits. They are lagging behind. We understand that is happening because the quantity is overwhelming. DFH will try its best to resolve that bottleneck. Thank you. Next, I will invite Mr. Chen Hangbin. Afterwards, 2 more members. I will allow them to ask their questions as well. And then that should be the end of today's meeting. Mr. Chen Hangbin, please. Thank you, Madam Chair. Thank you.
I have been listening to today's meeting. It seems that this meeting has not been effective because the government is not able to answer many questions from members. No clarification of fake news, no one answering the hotline, no medicine available. The hospitals have no more space. Are you saying that DFH is very free? No, they still have manpower to catch people buying Lianhua, Qingwen, Jiaonang, and they're able to guard against people from getting that Chinese medicine. So I think if you say that they are overloaded, no. And the situation about distributing wristband is very chaotic. The wristbands are just dumped at entrances. At the end of the day, people just approach our frontline officers. Our people are taking endless phone calls. We have to deliver things. Now, our colleagues are also infected. They are still working. They still take calls. Our manpower is inadequate, but we are determined to fight the pandemic. We hope that we are able to help out. Now, the SARG's messages are very chaotic. For elderly care homes, in some cases, in January, they signed for their elders to take vaccination. But then the government said if there is confirmed case, well, vaccination can only be done after 14 days. And then later on, they said this message is not true. So in January, signature was signed. In February, no vaccine available. And then all the way till now, no vaccination. We're talking about this situation in many elderly care homes. So where is the command center to fight this pandemic? Who is or which is the command center? I would like to know. Where is the command center, please? Undersecretary, do you know? Undersecretary, thank you, Chairman. The CE on many occasions said that she is the main person in charge. She leads the work to fight the pandemic over the past period in Hong Kong. Of course, under her, there are different bureaus doing operational work, implementing policies, and enforcing the laws. The Food and Health Bureau has its responsibilities. 2 to 3 weeks ago, support from the mainland came to Hong Kong, and the CE assigned 5 policy directors to be responsible for 5 different areas, those related to supplies, those related to testing, availability of medicine, and so on. So different bureaus divide up the work. Only in this way can our work be successful. Okay, Chairman, it seems that division of work is rather detailed. Now, members of the public can't get antipyretics when they have a fever. And sometimes, if their home is too small, they do want to go to quarantine center. If people live in subdivided unit, last night I visited one. There is an elder, there are children. One of the family members is confirmed. They want to tell the government that they need a place for isolation, but they cannot get through the hotline. So which bureau directors can help? Just now you said that division of work is really very fine. Okay, Undersecretary, concerning priorities and arrangement of people and so on, the mechanism is the responsibility of the DFH and HA. Then whom should we contact? We can't reach the Department of Health. Which telephone number can we use? Mr. Chen, many members raised the same point. So we will ask for a written reply to our questions. Okay, This is the third round, 3 minutes for each. Okay? First one, Ms. Elizabeth Quat. Thank you, Chairman. Thank you for allowing us enough time to ask questions and comments. Now, I have a few questions. First, the Undersecretary said that the central government supports our anti-epidemic work, so supplies will be very adequate. Adequate supplies will be coming to Hong Kong. Okay, there will be supplies coming to Hong Kong. Do you have planned how they will be made available to members of the public? Please do not rely on counselors and volunteers. Many of us have been infected. We can't help. So how are you going to deliver the supplies to the needy residents? Don't tell me that you have no plan. Don't just rely on us. Secondly, many members of the public said to me that they are really dissatisfied because very often you have experts and members in your team saying different things at different times. At this time, the worst message that we have heard is that we have already missed the best timing for vaccination, and we have missed the best timing for territory-wide testing. Now, you remember when we told you that you should do vaccination in elderly care homes to protect the elders? When did LegCo members tell you for the first time? We have been asking hard for territory-wide testing, and now we are under the 5th wave. Even now, you can't give us a timetable. And now the experts are telling us that the best timing has gone already. Then we don't need to do it. Now you said that you will do a territory-wide testing with grounding or semi-grounding in April. During this interim period, do we want to tolerate the pandemic? Many children under 3 years old can't get vaccination. Who are there to protect their lives? You said later. Okay, fine. Give us a plan. How to protect lives. Just now, some medical doctors said, even if there is no grounding, well, if there is no grounding, if you don't reduce people movement, you won't be able to break the infection chain. Even though you do not do territory-wide testing, you have to think of ways to reduce movement among people. Now, many people who have been confirmed still go to work because they need to make a living. But even if I am confirmed, I won't be quarantined, I won't be isolated, there are no supplies for me, I might as well just work. This is alarming. Well, human lives are precious. Tell me what you are going to do. There are not enough hospitals, so can you make use of the private hospitals? There are people who are confirmed but not recovered yet. They are still infectious. These people are elders. You cannot force them to go back to elderly care homes and infect other elders, because that may endanger their lives. This is unacceptable, Chairman. Undersecretary. Undersecretary, any response? Thank you, Chairman. I want to make one point. At any point in time, we will seize the best opportunity to help the high-risk groups to do vaccination. This is a very clear target of us. So we do have plan for elderly care homes, and we have been establishing places to vaccinate the children. Mr. Nip, once every 2 to 3 days, will issue notice about new vaccination or new injection centers, hoping to protect young children. It's now 5:08. There is still one member who has raised his or her hand. Okay, today, if you have questions, I want to allow you the chance to ask questions. And I hope that through the weekend, well, the administration will have a few more days, and next week, please give us a more concrete response. We all want to do a good job. We are all hands in hands. So, okay, there are some questions that will be left for next week, and I will also consider some essential things that may happen. Okay, we still have Kong Yok Fun, so at 5:15, I may still need to extend this meeting a bit. Then we will adjourn, all right? My turn now. I want to say you have actually missed out a number of best moments. I don't need to repeat those points. From the beginning till now, we are in the 5th wave already. The opportunities that you have missed, well, you should not take that as an excuse to tolerate the increase in the number of deceased. First of all, we have to make sure that the confirmed cases, those confirmed patients, have the legal responsibility not to go out. Well, this is not an excuse to stop territory-wide testing, even though you cannot admit all of them into hospitals. People do have their responsibilities. Now, I think that your system has already sort of broken down, and you need to think of this. Please don't think that you can just stay there and do nothing. Otherwise, the number of deceased will continue to go up. On the 21st of January, I suggested a coordination group between the two places. And some said this is not feasible. And I said, if this is not done, we don't have the chance of opening the border. So now we are talking about saving people's lives. We are no longer worried about reopening the border. And then we said we need mobile cabin hospital. And then we are concerned about law enforcement. Of course, we don't want to take that step. Now you do have enough power already. Please don't say that there are problems with the system. If so, well, we can use the emergency laws. And then I think you need to really unlock your mindset. You want to save lives. That is the most important thing. We are willing to help. LegCo can unlock for you. I have 3,000 boxes of Lianhua medicine, but then they could not cross the border. They cannot go through customs. So do we really need to invoke on the Hong Kong national security law? I am open-minded about that. I am looking at that. I'm willing to consider. If every day we continue to see so many people dying, tens of thousands of confirmed cases, this is unacceptable. So please restore our outstanding healthcare system that everybody saw in 2003 during the SARS outbreak. This time you have missed the opportunity because, well, there were already very serious outbreaks in elderly care homes. In fact, all these could have been prevented, but you have not done your work. You should not wait till April, okay? My comment is very clear. Our last member to speak is Kong Yuk Fun. Just now, I announced that I will extend the meeting by another 15 minutes from 5:15. Okay, thank you, Chairman. 344, Cap 344, about group gathering. I know that this is not related to the Undersecretary. Just now, Undersecretary said that we can have Zoom meeting, but can you go back to check with the DOJ in Chapter 344, in Cap 344? Well, IOs are not empowered to have Zoom meeting. Of course, we don't want to see group gathering. If you want them to have Zoom meeting, then please check with DOJ and HAB. Well, Zoom may not be a very good solution because we are talking about a few hundred households in a building. How can there be Zoom meeting? And sometimes we are talking about contracts, tender worth a few million. So can you talk to HAD? How can you help the residents? We have heard news that on Monday, the court will be closed till April. Now, if there are issues arising from that, there may be breaches of contract and so on, then the government can't help, they cannot go to the court. Then what can they do? Please think of this. Undersecretary, can you give an answer now or you need to go back to check? Thank you for the question. We need to do some studies. We can't give an answer now. Well, understood. Under Cap 241, well, there may be some emergency situations that can be exempted. Then people will have some peace of mind because these are exemptions that can help people's daily livelihood. So please check with other bureaus. Right. The first point from me now. We are dealing with some subsidiary legislations now. Do we want to invite the public to give us some written submissions? Written submissions only, right? If they have comments, then we can ask them to give us written submissions. Elizabeth Pott said yes. Yes, I think this is possible. Because there are things that even councillors may not be aware, so we can consider people's written submissions. So definitely we will meet again next week. We will proceed with clause-by-clause examination. I have received comments that, well, today, only Mr. Choi is here answering all the questions. We are all anxious. Next time, I hope that we won't only have the undersecretary with us.
There are so many things involved. It's not just one bureau who can respond to everything. At least tell us you have actively taken the issues to other bureaus. For example, the elderly homes, things are getting out of hand. So you have to present your request. For example, can we ask civil servants to help take calls on the hotlines? I've been taking calls since 8 a.m. this morning. There's a huge demand. Have you asked? Because you are the leading bureau in this. So next time, hopefully, we can meet with all 5 dedicated teams and have them respond to our questions. And 241N, how are you going to use that? That is the key in your hand. We know that is the key for everything. It's a universal key. Don't tell us you can't unlock anything. We are ready to help you. Remember, we are all working together. We hope to reduce the number of deaths due to the pandemic. Even one is better than none. So, Dr. Choi, hopefully you can reflect our points to other bureaus. Don't just say you will go back and ask, but bring representatives from different teams here. We are heartbroken. Everything is lagging behind. At the beginning, CAP 241 was in use. We were quite happy. But it's too late. And we're being overwhelmed by the current situation. For those who have spoken, you know we are trying to help the government. So hopefully the Secretariat can state our request. We want to understand what advice has been given by the Mainland Express, especially in terms of comprehensive testing, how and when to do it. Secondly, how to isolate people and the medical needs. We've heard news about relaxing things to allow Chinese practitioners to get involved, but what is a roadmap? And what about the progress? You need to inform us. We have the responsibility. You have a few days' time. Next meeting will not happen after Thursday. Definitely there will be a meeting before Thursday. Be ready to answer all our questions. Anything else that we need to put into writing? We have asked quite a number of questions. Can the Secretariat consolidate everything? We need to endorse 6 ordinances. We are responsible and we have the authority to ask you to provide the information to the public because it is not a normal situation in Hong Kong. We need to declare we are in some sort of emergency. You're being very backward. If we announce that now, we're already late. We've gone beyond the US and the UK in terms of number of deaths. It's very sad. We should have already declared state of emergency. So after endorsing these 6 ordinances, I hope that you will catch up very quickly. You need to tell us the coordination work. And finally, I should inform you, on the 11th of March, there was no House Committee meeting. The legal notice, or the several ones, had to be postponed. In other words, there is more time for the Secretariat to do the work. The extension period should it be the 6th of April? Secretariat, is that correct? And then when it comes to emergency regulation and then the masking regulation, everything should be dealt with at the same time. Because CAP 599, the 4 bills, the original date is 16th of March, but there was no House Committee meeting on the 11th. So we have taken the advice from the Secretariat to extend it. The date, based on our progress at the moment, is possible. So for 25th of March, for all 6 bills to reach House Committee. We will not separate them. I need to seek your support on this. If there are no special views, we will extend them accordingly. Any views from the Secretary? Anything from the Secretariat? At this moment, open you, Chen Hoyan. Questions about the process, the procedure? Ms. Chen first. I agree with your suggestion. We need to seek response from the Bureau. While we were asking questions, there's one thing not yet been updated. At the 4:30 PC, the center announced that the platform involves verification and uploading technologies which may be complicated. We don't have a fixed date. We already talked about that. We talked about reporting upward. There are 2 channels. So we can't wait until the next meeting. Things will be too late. Just like this case. Shouldn't we set a date? You said this at the press conference. There's no real answer presented to us. What about views from mainland experts? Don't wait until the next meeting. Can we set up a timetable? Every day we're fighting against time. So shouldn't we set a deadline for the replies? Otherwise, it will be all too late. Mr. Ho Kwon Yew? About procedure, I support and agree with what you proposed in relation to extension. I'm just thinking about the actual situation. Once we enter April, we have already gone through the exercise of being grounded and then masking arrangements in public places, group gatherings, everything are already being implemented. I'm not worried about the text. Of course, our terms of reference in relation to the 6 ordinances, no problem there. But for 241N, after obtaining the power, how does the CS to use it to address the issues we are facing? We need to make good use of our time, reflect it to the House Committee and see how we can leapfrog. How can we incorporate everything so that we can move along with the time during this unusual time and use unusual means? That's a very good idea. We have 136 new deaths in the past 24 hours. So we are in this state of emergency. We have more deaths compared to places undergoing war. 241N involves the CS coordinating and getting authorization to approve exemptions. I think that will help with our follow-up work, and also mainland expert advice. We can see there's a lack of consensus. So where is this lack of consensus? I think we need to submit something in writing. My original plan is to have a meeting on Tuesday. So perhaps tomorrow we can draft something for the administration, and hopefully Monday they can give us the reply with the information in our hands on Tuesday. I think it's most likely to happen on Tuesday, because many people are concerned about our meeting. First legislate and then scrutinize. Things already in effect. We are just looking into some text. Perhaps we need to fine-tune them in our discussion. We can follow up on the direction of policy and legislation, but we will not drag things along. And what? Tuesday, what time, please? Because I need to make arrangements. 2:30 to 4:30, I think. Is that okay for everyone? I hope to do it earlier. Tuesday, next Tuesday. That's the timetable. And it's a good suggestion from Chen Hao-yan. We will try to give the timetable to them. Undersecretary, one more time. Please present our clear messages. Otherwise, we will need to speed up the timetable, our work schedule. We can't be working in a scattered around manner. We represent the public. We truly represent the public in Hong Kong. To raise these requests and urges with you. So that's the end of today's meeting. If you have anything else, submit in writing and I will follow up on your behalf, okay? Thank you very much.